Hi there, my name is Dylan Thomas Doyle, and today I'm presenting our paper, I'm so overwhelmed, I don't know where to begin, towards developing relationship-based and values-based end-of-life data planning approaches, and I'm presenting on behalf of myself and my advisor, Dr. Jed Brubaker. A quick note as we get started that this presentation will cover the topics of death, dying, and grief, so please do take care of yourself as needed. Now here's the thing. 100% of us will die. Meanwhile, only 22% of people in the US have any sort of end-of-life plan. And we can imagine that even fewer people have data plans. Which is a problem, because each of us creates more and more data throughout our lives than ever before. And as data increasingly makes up a greater percentage of what must be considered in end-of-life plans, approaches should be designed to improve the effectiveness of that data planning. However, although data must be increasingly integrated with our end-of-life planning approaches, that integration so far has been slow or non-existent. So the research question that drives this study is, how might we design more effective end-of-life data planning approaches? Now, data is a broad category, so for clarity, the data that we are interested in here is any online or offline account or piece of data that an end-of-life management plan can potentially be made around. For example, one can consider networking accounts or social media, email accounts, photos on an external hard drive, all as potential end-of-life data. Now, this means that we are not interested in medical chart data or trace data or other data collected about users. We are interested in the data that users create and curate. And for clarity, we understand end-of-life planning approaches as the ways one might go about end-of-life planning. In non-data contexts, this would typically be your will or an informal conversation with your family. In the medical context, you can also think of an advanced care directive as a tangible example of a type of planning approach. The information systems we are interested in this study are data planning approaches, which we understand as the formal or informal tools, systems, or orientations that people use to conduct end-of-life data planning. Compared to traditional wills, data planning approaches are fairly new to the scene, quickly changing, and rapidly emerging. So when considering examples of data planning approaches that currently exist, to give some context to the study that we're conducting, we can look at some of what exists already in the wild, although there's not that much of it, because some end-of-life planning platforms are making space to help people plan for data. For example, in response to growing need, inventory-based and asset-based data planning approaches developed by legal firms and some industry players show promise in providing support. But these approaches are still largely focused on planning for financial assets, or assets with some sort of tangible value. They do not get at the deeper human-centered needs identified in previous HCI research, like digital legacy or post-mortem identity. Now here's one example of a popular website that has just begun to integrate data planning support. Cake has surpassed 1 million users, but their approach to data planning is entirely inventory-based and financial and asset-centered. So although this asset-centered view is very important, based on previous HCI literature that has found non-asset-based factors like digital legacy as important considerations for end-of-life data planning, it's reasonable to assume that asset-based approaches do not capture everything. So to help design more effective approaches for end-of-life data planning, we worked with 15 participants to co-design end-of-life data plans across multiple planning sessions. And we used a community-based participatory design approach, co-designing end-of-life data management plans with participants through ongoing consultation via semi-structured interviews. Basically, we made plans with people for them to use. And the study consisted of a pilot stage and a workbook stage, which I'll describe soon. Here's quickly a table of participants. We tried to capture a broad range of demographics. And here we note the participant numbers, the stages they participated in, the gender that they identified as, and their age. 5 participants participated in the pilot study using an asset-based inventory planning approach akin to estate planning approaches, which we call the inventory stage. And upon participants finding immense difficulty in completing actionable plans using that asset-based inventory approach, that document, that inventory document, was amended into a new workbook document for the workbook stage, which comprised the main portion of the study, and that included 10 participants. The workbook for the workbook stage was adapted in response to the specific challenges that participants encountered in the inventory stage, and took inspiration from design considerations outlined in previous literature. Compared to the asset-based inventory approach, the workbook approach was value-driven and relationship-centric. In the workbook stage, we adapted the planning approach to be much more heavily facilitated, closely walking participants through each step of that workbook. And in the workbook stage, we successfully co-designed workbook plans with 10 participants, creating actionable end-of-life data plans for each individual that they could go forth and use, which was a much more successful outcome than our pilot inventory approach. Now, the pilot approach took inspiration from estate planning tools and practices. Our inventory document sought to follow the conventional estate planning process of helping an individual meticulously list their assets, in this case, digital assets, and then determine wishes for those assets. In consultation with 2 estate planners, we adapted an existing digital estate planning guide to work for our exploratory and interactive methods. We began with an inventory approach because it reflects the most common approach that folks would experience. At a high level, the inventory document consisted of 3 steps. 1, creating an exhaustive inventory of accounts and data. 2, providing context for the use of those accounts and data. And 3, listing management wishes for each of those accounts and data. But there was a problem, because participants encountered huge challenges and issues in completing these inventory-based documents. The largest challenge that participants experienced was feeling paralyzed when asked to list their accounts and wishes, even getting started in the first place. And when asked about the underlying reasons for that difficulty, participants universally noted feeling overwhelmed as the reason they could not start or finish their plans. Participants named feeling emotionally overwhelmed when considering any part of their end-of-life planning as one factor in their paralysis. But to a much greater degree, participants emphasized feeling overwhelmed by the immense logistical stress of managing all those data and accounts. And that was compared to the managing of their more tangible assets, like physical family heirlooms. So the core challenges that we identified with participants in that inventory stage were folks were paralyzed by having an overwhelming number of accounts and data. Folks had forgotten accounts and data where they didn't even know what they didn't know and were concerned about that. Folks had unknown data in accounts, especially in email, not knowing which emails were important or even how to search for those. Folks had disorganized password management, some people having their passwords written down in 7 different notebooks and different file cabinets in their house. And then finally, we identified that folks were challenged by an inability to identify the most meaningful data in an account. Again, using that email example, just not knowing what to look for in order to manage. And based off of those challenges, here are a few of the amendments, examples of the amendments that we made as we transition towards the workbook document. But to summarize, our workbook changes and additions prioritized relationships between participants and their loved ones, prioritized specific timelines for participants and their loved ones, and prioritized connection to other planning documentation. Our workbook additionally sought to minimize participants feeling overwhelmed by limiting the number of accounts they were asked to list at the outset of the planning process. Our process this time around was also much more facilitated, with facilitators walking participants through the workbook with more granularity. So here's an example of the workbook stage of at least one page on it, and here you can see our shift towards beginning the planning process by identifying relationships and values that could inform the data management plan. We include both the inventory document in full and then the workbook document in full in the appendix of this paper. So in the workbook stage, we successfully co-designed workbook plans with 10 participants, creating actionable end-of-life data plans for each individual, which was a much more successful outcome than our pilot inventory approach. And we found that the workbook was successful due to starting small and iterating, again, starting with that small handful of accounts and then bridging out. Planning around relational values, so starting with, well, what actually matters to you instead of, well, what accounts do you have in the first place? And then finally, hands-on facilitation. And those relational values were really where we found the most amount of success, starting with what's meaningful to people, as opposed to starting with those accounts. Although starting with the meaningful element, we did get to those accounts quickly after. It was a matter of framing and more effective framing around relational values. There were also some lingering challenges, some of which were similar to what we saw in the inventory stage. First, in this stage, we saw folks challenged by access decisions. So who can access this account after I die, when, and how? Especially folks were concerned about family members, potentially growing up in abusive households, coming out to family members of folks that they did not want to know their especially gender identity or sexual orientation, and how to navigate that while also giving access to certain family members of certain data. And there were a lot of nuance in how people talked about access decisions that future research should continue to look at. People were also challenged by planning for catch-all accounts. Again, we have that email. What do we do? What do we do with email? What do we do with Google Drive, where all different parts of our lives are all together in one place and difficult to parse out that data? And then finally, forgotten accounts. We don't know what we don't know. How do we deal with that? What if there's something important and meaningful in there? Considering our findings, we argue that designers of end-of-life data planning approaches should consider, first and foremost, scoping small for success and iteratively expanding, starting with those few important accounts and pieces of data, and then moving out. Connecting relational values to data management, beginning with those most meaningful parts of why does this matter, and then moving towards the assets, the data, and the accounts. Facilitation, we found, is the secret to success. It is incredibly important, and this echoes previous HCI literature in this space. It's incredibly important to have that ongoing facilitation in doing this planning work, in addition to collaboration between family members especially and people who are planning, keeping dialogue around and alive. We believe folks who are designing should consider options beyond next of kin. There was a lot of folks who were prioritizing chosen family and friends and partners more so than families of origin, and that is something that we believe should be considered moving forward. There were concerns in these last three around what is important, and should we just throw something out, or should we just let something persist? And there's lots of future research in this area that needs to look at forgotten accounts. What do people default to in their planning? And then what is important, and how do people determine what is important in the first place? So for future work, we need to determine what the technical feasibility of these plans are. We need to look at more diverse use cases. Is this different for a late-stage cancer patient versus someone who's 18 and doing a long-term plan? And we need to look at cultural factors. There's different ways that different folks from different communities look at death and engage with death, and we need to consider that in our future work. Finally, just acknowledging my advisor, Dr. Jed Brubaker, Casey Paul, and Colleen Campbell, who are folks who have helped along the project, and additionally, the NSF, who has provided funding to help us do this work. So thank you all so much.